Dr. Huffaker, I wanted to talk to you today about the mini facelift. I know there's a lot of different names for it that are out there, and it seems to be one of the growing procedures, especially for the baby boomers. But exactly what is a mini lift?
Well, we have designed our mini lift different from many others. We looked at what we normally did in the facelift, and we thought several years ago, how can we minimize the recovery and still get the best result possible. And so we came up with a special type of mini lift that did these things that shortened the recovery period and yet still gives you such a good result that I frankly have used it for my main facelift now because we're getting such a good result with it. We've been so pleased.
So exactly who's a candidate for a mini lift?
Well, anyone can be a candidate for a facelift who's probably past the age of 40 or 45. It depends upon how much skin you have hanging down. If the more skin you really have hanging, the more apt you may need to have a full facelift or more of an extended facelift type of a procedure. But we've been impressed. We can do almost anybody, probably up to the age of 60 or early 60s, with a mini facelift and still get a good result. Basically, if you have skin hanging down from your cheekbones here, you're no longer a candidate for a mini facelift because we need to pull higher up in the temple area, so we need to undermine all this area up in here. But if you don't have that, probably a pretty good chance, unless you just have real big jowls hanging down here. Everyone has a little bit of a jowl hanging down right in the cheek areas here at the bottom. Sometimes we need to add some things onto the neck. We tighten the neck up with a mini facelift. We pull on the muscle back in here, on the platysmal muscle, and get some tightness. If someone has more what we call a bull neck or a turkey neck, more of a severe neck problem, then we'll need to actually make a little incision underneath the chin, dissect underneath all the tissue from here all the way over here, combined with the facelift dissection, and to get that tissue to really tighten up. We actually tightened up the muscles in the midline because some people don't really have they have sort of a straight line down from their chin down. They've never really had a good set back with their profile of their chin. So it just depends on how bad it is, but we can combine this mini rhytidectomy, mini facelift with any other procedure in the face.
So where is the incision for a mini lift?
I'd like to start at the top of the ear. I come down inside the ear itself, not in front, but inside the ear, hug the earlobe, come around the earlobe, and on the back side of the ear itself, and then either straight back into the hairline, or else sometimes someone has a worse neck, will come along the hairline itself down to about the level of the bottom of the ear. Sometimes we get a little bit better pull on the neck when we bring the incision a little bit lower.
So what areas does it correct exactly?
It corrects it helps with the cheek area into here, because the patients, you generally have a heavy fold in through this area. It helps the jowls in through this area, and helps pull the neck back also.
So how many years can you take off with a mini lift?
Depends on how young you are to start. It's really proportional. If you're younger, less than 55, probably about 5 years. 55 to 65, probably 7, and above 65, probably 10. It just depends upon how bad you are when you start out. If you've already had a facelift, this is your second facelift, probably 5 years additional.
So is it common for people to have this procedure again?
A lot of people have a second facelift. People ask, how long will a facelift last? Well, facelifts last forever. It's just you continue to age. And so, 5 years after the facelift, you're going to look 5 years older, but you won't look 10 years older. so that it's not like a window shade where you get up to a certain point and all the skin just falls down again. The results you get with the facelift is lasting, and then you age from there, and so it lasts quite a while.
If I'm one of those people that are very concerned with how I'm going to look after surgery, being afraid of having that tight, pulled look, the look that you see in a lot of Hollywood, a lot of plastic surgery gone wrong photos, is this procedure going to give me that really tight look?
No. The tight pulled look is overdone. People in this area like a more natural look. If they play bridge with their friends, they still want their friends to be able to recognize them across the table. They don't want to look like a different person. In Hollywood, perhaps they like to look like different people, but basically you're not going to get that different look from a facelift alone. You have to look, for someone to look different, you have to change the basic structure. Cheek implants, things like this, you've got to change the basic structure. Rearranging soft tissue is not going to make you look like a different person. So we like to give people a natural look.
Let's talk a little bit about the procedure itself. I understand it's outpatient.
Yes, it's outpatient. Occasionally, if someone has a facelift with maybe their eyelids and their neck same time, we may keep them overnight, one night. It depends a little bit upon this home situation.
Are you awake during the procedure?
We can do it awake or we can do it asleep. Most of our patients are awake, and we give you a little bit of oral sedation just to take the edge off. But it's really a very comfortable procedure. I've been impressed that people do quite well with it. I've never had anybody get up and jump off the table or even want to jump off the table. Occasionally we'll put you to sleep. Some people just don't like even the thought of locals. We can put you to sleep to do that, but most of our patients will have this awake under local. It's actually very easy to numb up the face. It's not as hard to numb up the face as you might think the way we do it. So don't dread that. It's not really a big deal. It's much harder to do other things that are local than the facelift.
So what is the recovery time?
It varies from person to person. I think that you have to sort of qualify recovery time. Recovery time, feeling good, they're feeling pretty good in 2 or 3 days. There is some swelling in through the cheek areas, a little mild puffiness, not to where you look strange, but just maybe like you gained a couple pounds for about 2 weeks. Most of the bruising on the face will drop down to the lower neck, upper chest, and so it gets it off your face. And may occasionally might have a little faint yellowishness in through the cheeks, but not much. But it really is a fairly fast recovery. We try to minimize recovery as much as possible.
What should a patient, I guess, expect after surgery? I mean, what changes will they see? You know, will people notice they've had a lot done?
The patient themselves will see tightness into the cheeks, tightness into the neck area. That's what the patient will see. Probably their friends won't notice anything. I warn people about this ahead of time because what you find is that people are not very observant. Some days, any of us look better than other days. And nobody takes a picture to keep reminding themselves how you look. And so most people, unless it's an extremely close friend, probably won't notice any difference. They may think they will know you look better, but they're not sure what you used to look like because they don't have a picture of you to remind themselves. But the patient themselves will see a remarkable difference. A lot of it depends upon how bad they are. Some people are pretty bad when we start. Some people are pretty minimal, but people will look better. They look younger, and it helps restore some of that youthfulness that you've lost.
So what do patients tell you most when they come back in after surgery? How do they feel? What do they notice the changes?
They just feel better because, you know, when you don't like the way you look, you don't act as well. You just don't feel good, so it really helps your self-esteem. So that's the number one thing that we patients are helped with, they feel better about themselves. And so because they feel better about themselves, their life becomes better for no other reason than they just feel better about themselves.